Good afternoon, everyone. Let me start with some news that was breaking just as we were walking in, and explains why Superintendent Brown is not with us at this moment. He was here in City Hall and had to leave. We've just learned that there's been a shooting involving a Chicago police officer. We have very little information at this point. We'll update you, and CPD will update you as we get more information about that. We're here this afternoon to bring you all up to date on what's happened with our city departments with the vaccine registration requirement. And as you can see, I'm joined by other leaders and representatives from nearly all of our city departments to give this important update. I'm pleased to announce that as of today, 13 of 35 city departments are at 100% registration on the vaccine portal, and 29 of 35 are above 95% registration. That means in total that we have 79% of city employees who complied with the vaccine mandate, and of that 79%, 84% are fully vaccinated, meaning that we're now one step closer to moving past this pandemic. And fundamentally what this all is about, it's about saving lives. It's about maximizing the opportunity to create a safe workplace. And let me contextualize these numbers a little bit more. If you take out police and fire departments, the percent of city employees who submitted their vaccine status through our pipeline jumps to 96% from 79%. And of that 96%, 81% of respondents reported being fully vaccinated. And while we continue working to get this number as close to 100% as possible, this is without a doubt a huge win for the health and safety of our residents. Commissioner Owen and his team, and let me just say, where's Chris? He's a shy guy, not a guy who steps out in front, but he and his team have done unbelievable work throughout this whole process, and particularly over the last couple weeks, making sure that we're in communication, educating our workforce about what the requirements are, making sure that we simplify any requirements on them as much as possible to relieve any burden. His team worked round the clock all weekend long to make sure that they were getting data and information out to their colleagues in city government. So I think Commissioner Owen deserves a round of applause. So he and his team are going to continue to work to clean data to share with all of you as soon as possible. We know that the best way to get to the end of COVID-19 is by getting vaccinated, pure and simple. And as city leaders, we have a responsibility to ensure that our staff is safe, not just for the safety of the general public they serve every day, but for the safety of themselves, for their family members, for their coworkers, and for members of the public, of course. As I've said before, but it bears repeating, the health of our city workers directly impacts the health of those that they interact with on a daily basis, making it critically important that these interactions are as safe as possible for everyone involved. Again, we understand that some people still need time to get vaccinated, which is why our vaccine has a temporary testing option. Our vaccine policy has a temporary testing option. However, we also understand that testing is not the best way to ensure a safe workplace and interactions with the public. Therefore, getting fully vaccinated remains our goal. We'll continue to push, we'll continue to educate, and we'll continue to do everything that we can to meet people where they are, understand what their fears and concerns are, and make sure that we are doing everything that we can to get them the information so they feel comfortable getting fully vaccinated. That's why city employees who fail to report their vaccination status through the portal will be placed on a non-disciplinary, no-pay status, but we're still going to give them one last opportunity to do the right thing. We're going to give them, as we reach out to them, to let them know we're seeing you're not on that in the portal. We're going to ask them if that's correct or not. We're going to be right there with a computer to help them get registered in the portal. And my hope is that we don't have to take any actions for folks, because it's a simple process, as we've demonstrated over and over again. You go to a portal, you click yes or no as to whether or not you're vaccinated. If you are, you put in your information. If you're not, you go to a second screen that allows you to sign up for a testing option, which begins today. So we try to make this as simple and straightforward as possible. And I'm happy to report that of the big cities, we're the first. We're leading the nation, again, because of the hard work and sacrifice of so many, and because we have placed an emphasis on making sure that we lead when it comes to public health. We believe in the science, we believe in the data, and we believe that the best way for us to put the pandemic in a rearview mirror is to make sure that we're getting all of our employees and all of our residents vaccinated. Again, I want to emphasize that the temporary testing option does end and sunsets on December 31st of this year. So we need all of our workers within all of our departments and agencies to step up and do their part to end the pandemic by getting fully vaccinated no later than that date. And it's my hope and expectation that each and every one of our city workers will join with us in this citywide effort. Again, I want to thank all the employees who have complied with our vaccine registration mandate. Very, very important that we give kudos where kudos are due. All those who were fully vaccinated by October 15th will get that personal day. I heard from folks over the weekend that they're looking forward to taking advantage of that personal day. And I can't thank the cabinet enough for all of the hard work. This was not easy. This took a lot of work across every city department and a lot of effort and energy to these folks who are the leaders of our city departments, and the others within the city departments that really made this happen. And I'm very, very proud of the work, and I hope you all are as well. And at this point, we're happy to take your questions.
Thanks a lot, Mayor. We're going to get off with Tamam Bradley up front, and 2 questions per reporters, ladies and gentlemen. Thank you.
Mayor, thanks very much. Can you tell us what's going on over at CPD headquarters right now? We hear that officers are being called into a room. They're being given an opportunity to report. They're being offered an opportunity to speak to counsel, perhaps, and then they're going into a different room and being stripped of their police powers. Is that what's happening?
I don't think that's 100% accurate. Since this morning, CPD, starting at headquarters and then branching out to other divisions, has a list, making sure that they're going to the individuals who are on that list, talking to them and verifying whether or not they've actually signed up on the portal, which again is very simple. Yes or no vaccination, or you're going to take the testing option, providing those individuals with the opportunity to be in compliant if in fact they're not, and then in instances where they're not, taking action from there.
And so people who are not reporting, is it correct that they are being relieved of their duties?
The people there's a very small number of my understanding, and I don't have all the figures at my fingertips, but my understanding is a very small number, even after given those opportunities, are not doing it. And then in those instances, a CR is being taken out. They are put into a no-pay status, and then the disciplinary process will proceed from there. But my understanding is it's a very small number after all those opportunities that are doing that.
Amber Gilmore, Univision Chicago.
Actually, I did have a question more about in general, COVID, the numbers, if you mind discussing, or we have Dr. Awardi, if you have a second for us. We could do it right now, we could do it at the end.
Yeah, no, we can do it now.
Okay.
That's fine.
Just if you could just in general, I know Dr. Awardi mentioned about that if we go down 200 cases per day, that there might be a chance of getting this mask off inside places. Is that accurate, or when are we moving forward?
I'll let Allison answer that question.
Thank you.
So one of the reasons, obviously, that we've been pushing vaccination is it is the most important thing in terms of making everybody as safe as they can. I know there's a lot of interest in not needing to wear the mask. I, of course, would love to be in the place where we would not need to wear masks. As you noted, if we were to get below 200 cases per day and stay there, which is where we were over the summer, I have been talking with IDPH about taking that regional approach and being able to remove that as an an indoor mask requirement. We are still over 300 cases per day right now, so I don't anticipate that to be imminent. And I'm a little concerned that when we look at the upper Midwest, Minnesota is very much on the way up, Michigan is very much on the way up, and Wisconsin is also starting to be more on the way up. It's colder up there, and we know that typically as cold weather comes, we see respiratory viruses start to spread. That we always have a flu season, we have the childhood virus season, and so really my focus at this point is around vaccination, because where we can get folks vaccinated now, it helps protect them through the flu season and what will likely be, I would expect, some increase related to weather. So certainly we're continuing, I'm sticking to those numbers like we shared them from the beginning. If we get out of that substantial risk category, I'd be very happy. But really looking ahead, we'll have a better sense, I think, by about Thanksgiving. And really, we're going to be putting out tomorrow when we share this. Right now is the time, if people are not vaccinated, to start getting that vaccine if you want to be fully vaccinated by Thanksgiving and you want to get both of those doses. So now's the time to do that. And part of the reason for the timing of our requirement at the city level was also getting ahead of what could be a fall and winter surge.
Thank you.
All right, Dana Kozlov, front and center.
And Dana, before you ask your question, I just want to add a little more color, if you will, to the comments that Dr. Arty made. If you think about where we were a year ago, we were in the midst of a fairly substantial surge in cases. We had no vaccines at that point. We were seeing people going into hospital ICU rooms. And I think it was right about this time that Dr. Arty and I came out and said, this Thanksgiving can't be like other Thanksgivings. Stay home in your family unit and don't celebrate. We're not doing that this year. And why is that? Because of the vaccine. Because we've seen so many people across our city and really across our country get the vaccine. It's made a world of difference. We're not out of the woods yet by a long shot, but we're getting there because of the vaccine. Go ahead, Dana.
Mayor, you are saying you understand it's a very small number of Chicago police officers who are being placed on no-pay status. We are being told by some that it could be dozens or a couple hundred officers. With that, and a police officer vacancy of, depending on who you talk to, 900 to 1,600 officers right now, what concerns do you have about how this might impact public safety?
Well, look, what I've said is this. It's a very simple, non-burdensome, non-intrusive process. And I think what I'm hearing anecdotally, for those who are having those conversations today, because they hadn't signed up before, they're seeing with their own eyes what it actually is. They're going to the portal, they're seeing the very minimal amount of information that's being requested, and most people are understanding that whatever they thought it was, it's something very different. Whatever they'd been told, frankly, in many instances, they weren't told the truth. And so there is, I think, an eye-opening moment for many people that this actually is a pretty straightforward, non-intrusive process. Now, where the rubber is going to hit the road, obviously, is for us, is educating people to get them vaccinated before year's end. But I feel like we have made a lot of progress, and the numbers really speak for themselves. We have made a significant amount of progress as we've gotten people focused and educated about what the requirements are, but in particular, disabusing them of a lot of the noise. So, again, we'll see how the week plays out, but I think it's pretty straightforward. People are understanding why it's important. And I'll say what I said last week. I really hope that the men and women of the Chicago Police Department, who have been fed a lot of stuff, that's the most polite and appropriate word I can use in this forum, are not going to ruin their careers over going to a website and saying yes or no. And I think that recognition is starting to occur to folks.
Just to follow up, though, you said we'll see how the week goes, but do you have specific concerns?
I'm sorry, do I have specific?
About how removing officers from the job, even if it's only for a week or two, might impact public safety?
Well, look, you know me well enough from this podium. I don't engage in a lot of hypotheticals. Obviously, we have contingency plans that have been in place for quite some time. I think what we're seeing is the number of folks who are actually, after being given the opportunities and even a direct order, saying no is very small, very small. So I'm not seeing, at least for through this day, that there's going to be any disruption in our ability to keep our neighborhoods safe. We've got to keep plugging away at this. There's a lot more people that have to be reached, and that will play itself out over the next couple days. But again, I think the important thing is this is a really straightforward process. We're not asking intrusive information. You have the option to go to to the testing option, and the truth is a lot of them are actually vaccinated. So this isn't about, to me, it's not about vaccination. This is about something else. And as I said, I think our young men and women in the police department are smarter than maybe they've been given credit for. They're not going to risk their careers by being insubordinate and having in their jackets the fact that they defied a direct order of their supervisors. I don't see that.
Okay, Marianne Ahern, NBC5.
There has been some reports that there was a judge that got involved, perhaps that the fire department might have someone from their union to stop this checking and no pay status. Is there any kind of judge?
I have not been given any information to suggest that that's so. You know, of course, that the police department, the police unions filed a TRO last Friday following our action in court, but I have not heard. I'm looking at Commissioner Holt, who's shaking her head no, but obviously if there's something that's happened, I actually just saw the head of the fire union as we were walking out, shook my hand, was very cordial as he always is. So if there's something that we need to report, we definitely will.
And then finally, one of the issues that the FOP president talked about today, he keeps saying this is not about the vaccine, it's about bargaining, and that because he didn't feel that there was they were at an impasse and went to arbitration, CPS testing is being paid for. Police, they had to pay for their own testing.
Everybody that's a city employee, on their time, on their dime. Everybody that's a city employee, obviously CPS is its own system, but everybody who's a city employee, we're not singling out any department, certainly not the police department. Anybody who opts for the testing option, and we've been very clear with every union since August that testing, once we put it on the table, it's on their time and their dime. It's okay, Yasha. So it's not something that's unique to the police department. Every single department.
But CPS is separate. CPS does not have
CPS is a separate entity. They're not a city department, so we don't control, obviously, what goes on over there, and they've worked out an arrangement with the CTU and the other unions that represent the CPS employees.
All right, Megan Hickey, CBS.
Also CPS related, we've gotten a couple complaints from teachers who've said that they were planning to get tested on a certain day, and when they reported to the nurse's office, there weren't enough testing supplies. Wondering if your office was aware of that, if there is a supply issue.
I'm not aware of that being an issue at all. And frankly, there's testing resources all over the city. And they can either go to the testing at their local school, or they can go to a number of other testing options, whatever is most convenient for them. But testing is still very widely available, so there should not be any issues. And I haven't heard that trickle up to my level, that there's an issue regarding testing availability.
Okay.
Viviana Avila from Univision Network.
Hello. There has been any effort from the mayor's office and the police union to talk about this vaccine mandate? Is there any effort to sit down and talk about this vaccine?
Oh, I mean, we've been talking to the police union since August. So I think Mary Ann may have raised the issue. There's allegations by the union that we haven't bargained in good faith, that they haven't had sufficient time. That's just simply not true. If you look at the papers that we filed in court, we detailed literally every meeting and all the efforts that we made. There were some weeks where we didn't meet, but not for lack of effort on our part. We were trying to consistently bring the unions to the table for a whole host of reasons, not the least of which is we wanted to be able to make progress. And the few times that they came back to us, they came back with proposals that they knew were absolutely going to be unacceptable. Like, well, I won't go into the details of that, but the bottom line is we worked hard with every single union that represented city workers to make sure that we got their feedback, and the policy was absolutely modified as a result of the feedback that we got from a number of different union partners who came to us in good faith, expressed concerns that they were hearing from their membership. Now, we weren't ultimately able to get a deal with any of them, but it wasn't for lack of effort on our part, and certainly it wasn't for lack of effort with the various police unions, FOP, the unions that represent sergeants, lieutenants, and captains. We were at the table and consistently trying to reach an accommodation with them, but the record, I think, speaks for itself.
All right, Mariah Wolfo from WBZ, last reporter of the day.
Yep.
Hi, Mayor. I also have a couple of questions from colleagues who aren't here,
Sure.
but one from me. The FOP attorney indicated on Friday that the union might be satisfied if there was a third option to say, I don't want to share my status, but I'm opting for regular testing. Is that something you would consider?
No.
Okay. And
look, we've been at this since August. Mm-hmm. We gave them every opportunity to come to the table. And candidly, the FOP tried to, those of you who are old enough to remember the term rope-a-dope from, I think, Muhammad Ali boxing, they tried to rope-a-dope us. They didn't come to the table. We need more information. We don't have time. We need to consume the information. Look, we get what the game is. But the bottom line is, like with every other union, 39 of which, or 38, I should say, that represent city employees. We sat down at the table. We tried to understand what their issues were, but no one can say that we didn't bargain in good faith with absolutely every single unit that was at the table, FOP and the other police unions as well. We tried mightily. Because it's obviously better if we can reach some kind of common ground. But you're going to negotiate, and once we bring you to court, that's not the way to get things done.
Okay, thank you. And then from the Daily Line, last week, aldermen introduced 8 budget amendments, including proposals to cut vacant police positions, reopen mental health clinics, and end the city's contract with ShotSpotter. Do you see room for movement on any of those items, or are you going to push to keep your budget proposal as is?
Well, I haven't had an opportunity to digest them because they were literally coming in up till Friday. But as always, we work in good faith of the members of City Council to see where we can reach some common ground if possible. So we'll evaluate those, reach out to, and we've already started that process of reaching out to the sponsors of the various amendments, and where we can reach some common ground, we will. But the most important thing is we got to move forward. We got a lot of people across the city that have significant needs that we've got to meet now and in the future.
Okay. And then 2 questions from A.D. Quigg at Cranes. Inspector General Joe Ferguson was extremely critical of your administration on his way out the door, saying the
Who was that?
Inspector General Joe Ferguson.
Who?
Former Inspector General Joe Ferguson was extremely critical of your administration on his way out the door, saying the competencies simply aren't there in this administration. As someone who ran for election on a platform of good governance and reform, what's your response?
Well, I think my record speaks for itself. What we're focused on is making sure that we get a new, strong, independent Inspector General who understands the importance of staying in their lane, but importantly, making sure that they're true to the mandate, getting investigations done in a timely fashion, because if we've got issues and challenges, we need to be able to address them now and not years and years and years after the fact. So I'm looking forward to the future. I'm not going to worry about somebody out the door who's saying whatever they're saying.
Okay, last question. Can you tell us anything else about this group you're forming to look at the future of Soldier Field? Who will be on it, and are they looking at a post-Bears future? adaptations to help them stay, or some mix of both?
Yeah, we'll be making an announcement later this week about who the members of that group are. But as I said to you, this whole conversation around Soldier Field has really led me for months now to think about how is it not only that we maximize the fan experience at Soldier Field, but really thinking about that campus from Shed down to McCormick Place and making sure that we are taking advantage of every opportunity there, consistent with the law, and obviously we'll be engaging with Friends of the Park because they're an important stakeholder here. But I think there's lots of opportunities for us. We're going to look at what other cities in similar situations have been able to do over legacy stadiums, and I just think that there's a lot more opportunities. I was there yesterday. I won't talk about the result and my feelings about Aaron Rodgers, but we can reserve that for another day. But I do think that there's a lot that we can do to really maximize the experience for fans, both in terms of traffic management, dining opportunities. I don't think it makes sense to me that we've got this incredible asset of Soldier Field that is a very sought-after venue, but we see that from August to January is locked up primarily around Bears-related activities, but the rest of the year, there's not much going on there. And I also think that we've got to provide some dining opportunities on that campus so that families have more options than very high-priced chicken fingers within the cafeterias at the various museums. I just think there's a lot that we can think about and do. And obviously the Bears are going to be part of that conversation. We continue our discussions with them. But it's a bigger issue than whether the Bears stay or go, as far as I'm concerned.
And Mayor, Craig Wall was already here. I just want to give him a chance to ask this question.
Mayor,
Okay.
pardon me if I'm asking questions that my colleagues asked.
Yeah, no
I
problem.
wasn't here to hear them. But obviously, it seems that FOP was trying to test your resolve in this whole matter. Is this action that you're taking today against them, is this just meant to send a message to them?
And let's be clear, it's not an action against the FOP. I deeply believe that the only way that we can maximize safety in our workplace is by getting our employees vaccinated. You know, somebody raised a question the other day, which I thought was a great question. I think it was Heather Sharon. How can people feel confident that the city workers that they're interacting with on a daily basis are there to actually help them and not transmit COVID-19 when they respond to city residents when they're in need? And that's the question. And the only way that we can answer that in the affirmative, that our city workers are really there to help them, and of course they are, but to keep them safe, is by getting vaccinated. Members of the public have a right to feel that level of confidence from the variety of city workers that are out in neighborhoods and interacting with residents on a daily basis. So I don't view this as, Lightfoot against the FOP. I think that's the wrong frame. What this is Lightfoot and all of these city commissioners and leaders saying, we're going to stand up for public health and public safety, and we're going to make sure that our workforce is as fully vaccinated as we possibly can be.
Do you have concerns about what this might do to police morale?
Well, what I have concerns about is seeing more officers die needlessly of COVID-19. Again, you're all aware, we had 4 officers who passed away in 2020, every single one of them from COVID-19. Every single one passed away before the vaccine was widely available. I want to make sure that our officers who are literally working their tails off every single day, risking life and limb, are absolutely able to take advantage of this life-saving vaccine. That is a key focus of mine. I don't want to see more officers die needlessly. You've seen the reports over and over again. There was another report this morning. Number 1 cause of death in law enforcement in our country is not the things that you would expect. It's COVID-19. It is shocking, but preventable if we get people vaccinated.
Thank you, Mayor. That's a wrap, everyone. Thank you very much.
Is there any way I could just clarify?
Yes.
I just want to make sure we have the right numbers.
Okay.
Okay, so 1333 said no, but there's more than 4,000 police officers who did not respond. So you still, you have to go through more than 4,000 officers, correct?
I don't know that that's the right number. Chris, do we have an updated number for that?
I'm sorry about that. I don't want to report the wrong thing.
Hold on, let me just check my cheat sheet here.
4,453. 4,543 not
Do you have the-
responding.
Is that the right number?
4,543 officers.
Pardon me?
Not.
Just give us a second. You want to come up to Chris?
Trying to do the math here.
Give us a second. Say again. Point of clarification too, is this no pay status happening in all city departments where people are?
Yeah.
Still need to report.
Pardon me?
4,543 still need to report.
4,543 still need a report.
Okay, so that's still high.
Is that police and civilian? Or?
That's the entire department.
Yeah, that's police and civilian. We'll get you a breakdown of what that number is for just, I'm assuming what you're most concerned about is just the sworn.
Thank you very much, Mayor. Appreciate it.
Is this counseling session at headquarters where the officers are being brought and given the opportunity, is that same thing happening at other departments?
Yeah, Dana just asked that question.
I just want to make sure.
Yeah, I mean, most of the other departments are, and you missed this part. Most of the other departments are 90% or higher. Some that are at 1,000%. Many are over 95%. But yeah, any worker who we don't have evidence that they've signed up. We're going through a process to verify if that information is correct, because we've known some that said, oh, no, I did it, but it's not showing up. I think that's a small percentage. And we're giving them every opportunity to make sure that they sign up. Again, it's a very simple process. Yes or no regarding your vaccine status. If the answer is no, then you've got to sign up for the testing option. That's it. So it's not burdensome. It's not intrusive. We're not asking for excessive amounts of medical insurance. Everything is HIPAA and ADA compliant. So we expect people to just answer very simple, straightforward questions. And we're giving them every opportunity to do it. And hopefully the ones that are out there that haven't yet will get the message, because we're coming to make sure that we're talking to you. So save yourself a lot of headache, a lot of heartache. Sign up. Thank you, everyone.